Hello and welcome to the lecture on meniscus tear. What is meniscus? We should know the anatomy of the meniscus first and then go to the injury and the tear of the meniscus. Well, menisci are the two wedge-shaped pieces of fibrocartilage act as shock absorbers between your femur and tibia. So these are menisci and the menisci help to transmit weight from one bone to another and play an important role in knee stability. And in normal knee anatomy, the menisci are two rubbery discs that help cushion the knee joint. It means the friction is uh, decreased during jumping on knees and making skipping jumps. So now we will learn the clinical definition, symptoms, the diagnostic methods, and the possible therapies to cure that meniscus tears. When a knee injury, which is caused by meniscal tears, actually we categorize it into two types: the acute meniscus tear and the age-related degeneration of meniscus. So, uh, there is term terrible triad. For example, in the knee injury, for example, high force or high energy traumas to the knee, there are three types of injuries together. So, what are these injuries or tears? The anterior cruciate ligament tear plus medial collateral ligament tear with meniscus tear. We say this type of triad, terrible triad, which is caused by the high force or the high energy. Typically, about more than 30% meniscus tears are associated with anterior cruciate ligament injuries. So, we have to know that there is possible injury to the anterior cruciate ligament with the meniscus tears. Well, there is high force or high energy trauma to the knee joint into the knee joint. Already we should know about that what are the epidemiological characteristics of meniscus tears. The male are more affected than female because the due to sportsmen or like this and due to heavy works, and the people who are less than 40 years are more likely to have acute tears, but the people more than 40s, they have more chances to have degenerative tears. And then this is more important that medial meniscus tears are more common than lateral meniscus tears because there is decreased mobility of the medial meniscus as it attaches to the medial cruciate ligament. And so we already know the location of the meniscus. Here I will also repeat again the anatomy of the meniscus. Well, menisci are located between the femoral condyles and tibial plateau, and they act as shock absorbers. So now we will discuss the risk factors like how and what are the possible factors which are leading to meniscal tears. Acute tears, for example, people who are sportsmen and playing heavy games, mostly the football games, because there is more chances to have knee injuries. And so what are the degenerative tears? People who are older ages, because the fibrocartilages are degenerated and there is more chances to have a tears because of degenerative tissues in the menisci. Other risk factors being a male gender because the work-related use of knee, for example, kneeling, squatting, and stair climbing, and obesity is also a risk factor because of high weight and there is high force on the meniscus. So let's talk about the symptoms of meniscus tears. So in acute tears, there is joint pain after inciting events, and it is usually a persistent joint pain. And in the degenerative tears, the patient will have incidence onset of knee pain. There will not be a persistent joint pain unlike acute tears. So other presentations, the patient will have the feelings like locking, popping or catching of the knee during ambulations, and during ambulation there will be a pain, and for example when the patient is climbing stairs, and there is a sensation of joint giving away in the meniscus tears, which is typical. In the physical examination of the patient with the meniscus tears, there will be knee effusion and swelling that worsens with activity, and it is most common with acute injuries, and the knee pain that worsens with motion, especially with deep knee flexion, and there is focal joint tenderness, impaired range of motion, there will be limitations in motions, and there will be a normal patellar tracking. So there are two tests that screen and diagnose the meniscus tears: Thysell test and the McMurray test. In the Thysell test, the patient is asked to stand with the knee flexed to 20 degrees, and the physician have the patient the patient is twisted externally and the leg is rotated internally, and any discomfort or mechanical symptoms is a positive test. And in the next test, that is McMurray test, we do it for medical meniscus tear. So uh, we flex the knee and palpate medial side of the knee and externally rotate the leg and bring the knee into extension. Any palpable pop or click is a positive test, and for lateral meniscus tear, we do the flexion of knee and palpate lateral side of the knee in this time, and the leg is rotated internally, and we bring the knee into extension. So any type of click or palpable pop is a positive test of for the lateral meniscus tear. So we have different imaging modalities, but MRI is indicated to diagnose the meniscus tear. So we have to rule out other bony pathologies. Uh, for example, there could be possible osteoarthritis, that is degenerative disease in joints of older people, but in MRI we have the findings. There are hypertense signal inside the meniscus in MRI. Well, talking about the differential diagnosis, there are same presentations as meniscus tears in anterior or posterior cruciate ligament injury and the osteoarthritis of the knee. In ACL and PCL injury, there is positive Dreyer sign, but there is no such sign in the injury of meniscus. And in osteoarthritis, there is no diffusion, unlike the meniscal injury, and there is joint stiffness is present in osteoarthritis, but there is less chances of joint stiffness in the meniscal tears. So now it's time to talk about the treatment of the meniscal tears. So the meniscal tears actually can be managed conservatively with surgery, and actually it depends on various patient factors. For example, the patient's age and the presence of comorbidities and the extent of tears. And the conservative management, if there is degenerative tears or asymptomatic tears, and for example who cannot be a candidate for surgery, and other multiple comorbidities, we do conservative therapy for those patients, mostly rest and ice, knee sleeves, and usually crutches. These are proper conservative management for the meniscal tears. Well, medical therapy is for the patients to manage the pain, and in operative therapy we do the arthroscopic repair of menisci, and this is indicated for the symptomatic tears, plus if there is failure of conservative management. And there are two modalities or the surgeries, the partial meniscectomy and the meniscal repair after the meniscectomy. For example, if the meniscus tears, we have to prevent the fibrosis of the ruptured tears, so we do the partial meniscectomy and do repair of the meniscus. So the complications of meniscus tears are the fibrosis and septic arthritis. Fibrosis means if the fibrocartilage is ruptured, obviously it will get fibrosed. So it's end, and please subscribe my YouTube channel to watch other orthopedic videos on my YouTube channel.